To achieve a more thorough result in support of the neck, we will continue treatment on the trapezius muscle in the upper back. The trapezius muscle is a large superficial back muscle that resembles a trapezoid. It extends from the occipital bone at the base of the skull to the lower thoracic vertebrae in the mid-back. It situates on top of a number of other significant muscles that form the foundation of the neck, like the rhomboids, splenius capitis, and levator scapulae, which will all receive treatment from this routine. To begin this treatment correctly, one must identify where the spine of the scapula is on the shoulder blade. The thin blade of the AcuLever will situate above and parallel to this bony ridge. In this diagram, two marks are shown to identify where the blade should be placed for the first treatment site with respect to both the muscle and the bone. In the routine, only one blade will be utilized at a time. The best way to approach this treatment is to think that it begins with an elbow that is pushing deeply on the muscles above the scapula or shoulder blade, as this massage therapist is executing in this image, with approximately 2/3 to 3/4 of the fin blade making contact. The number of treatment sites worked on is up to the user, but in the following diagrams 4 sites are shown. You will work down to the spinal column and then change the angle of the tool for the next routine. You will not use the lever plate during this technique, only using the Orca fin blade plate by itself. This demonstration will show these 4 treatment sites. Note that the head is coming all the way to the floor or the table with each repetition for the maximum depth for this technique. There is no need to move the AcuLever, just merely shift your body to the side with each successive repetition. You can hold longer at any of these sites if one area has more scar tissue adhesions. The next phase of this routine, 3 sites in this demonstration, will use the entire fin blade. You will rotate the AcuLever so the fin blade will situate at approximately 45 degrees, shown here on the muscle and in relation to the scapula, walking down the lower trapezius towards the spinal column. Rotate the tool to begin. Note once again that the head is coming all the way to the floor or the table with each repetition for the maximum depth with this technique. There is no need to move the AcuLever. Just shift your body incrementally to the side with each successive repetition. You can hold longer at any of these sites if one area has more scar tissue adhesions. In this last phase of the routine, 3 sites in this demonstration, the entire fin blade will make contact adjacent the spine. The AcuLever fin blade will situate parallel to the spinal column and then walk upwards towards the neck on 3 different sites. The technique of rolling onto the AcuLever in this position is enhanced with a simple arm movement. Extend the arm to the side in a fluid continuation of the body's roll. Extending the arm in this position will drive the blade deeper into the muscle, breaking more scar tissue adhesions. There is no need to move the AcuLever. Again, merely shift your body incrementally with each successive repetition. You can hold for longer at any of these sites if one site has more scar tissue adhesions. It is advised to hold longer in this last position just below the neck, extending the arm out to the side to complete the routine on a very deep level.